Welcome to this music therapy morsel. My name is Mary Jane Landacre, and I'm the owner of musictherapyworks.com, a proud sponsor of these music therapy morsels. In the next 5 to 6 minutes, we're going to provide you with a brief taste into one of the clinical responsibilities of a music therapist. These morsels are very much designed to give you some specific practical tips of things to think about and things to work on as you are getting into your own music therapy program. And we'll provide you with just general questions and challenges of things to think about. If you're interested in more information about any of our topics on music therapy morsels, please check out the website at musictherapyworks.com on the webinars and courses page. Thank you. Today's topic is music therapy assessments, and we're going to start off just really quickly by talking about all music therapy assessments. All music therapy assessments try to answer two basic questions. The first is, why is the client coming to music therapy as a treatment modality? And the answers will vary. Sometimes it will be, well, it was recommended by a friend of mine. Sometimes it'll be something along the lines of, well, I really like music. Sometimes it'll be, well, we've tried everything else and nothing else has worked, and so we're going to try this. In addition, one of the things that we seek to know when we're assessing clients is, what are their potential goals? What is it that they want out of the therapeutic engagement and process? The second question is probably more important than the first. It is, can music and music therapy assist the client in reaching his or her goals? Sometimes the answer is yes. Sometimes the answer is no. We hope that the answer is yes, of course, because then they'll become a music therapy client. But sometimes music is contraindicated, and that is very important to recognize. So, how do we do this? How do we answer those questions? One of the things that we do as music therapists is we do research. We try to know something about the client. We try to know something about the client's diagnosis, and we want to know something about what the client is working towards. In addition, we also want to make sure that we understand some of the music therapy techniques that are out there, some of the theoretical foundations, and the techniques that other music therapists use when working with these clients. We ask questions. That's another way we get the information that we need for our assessment. We sit down ahead of time and we figure out what we want to know, and we ask the client for the answers to those questions. We might ask questions about former musical experience. We might ask questions about musical preference. We might ask questions about specific goals that a client wants to go through. And one of the other things that's very important is that we always must presume competence. You always direct your questions directly to the client, because nothing is more dehumanizing than sitting in a group of people where people are talking about you and you have nothing that you can contribute to the process. So even if your client is labeled nonverbal or is identified as somebody who won't talk to you, always address them and make sure that they have opportunities to be a part of the conversation as well. A lot of times our clients who can't speak can communicate their preferences and the ideas, but they don't necessarily do those things verbally. We also spend a lot of time making educated guesses because, I can make a wonderful assessment plan, but a client may come in and want or need to do something different during therapy. So I rely on my knowledge and expertise to help me form hypotheses. This is what I think the client will do. This is how I think the client will respond. But we're not always right when we make those educated guesses. And that's where it's really important to base our ideas on our education, our philosophy, and our experience. As a therapist, if I can base my predictions on something that I've learned about people, it makes for a stronger assessment. If you have supervision resources available to you, use those resources to assist you in making those educated guesses. And then we try things out. You can think about situations, you can envision how a client is going to react and respond to music therapy assessment as much as you can, but until that client and you are actually in that experience, you don't know what will work and you don't know how things will happen. And so because of that, we try out something, we see. Data is a very important part of music therapy assessment, and that's why we take data. It's the backbone of assessment and treatment. most people who are going into therapy want to know if they're actually making progress towards their goal. And so it's important that we as a therapist take data to assist them in seeing whether or not they're making that progress and to make decisions about what they want to continue to do in therapy. And then we revise. We go through the process to make sure that our client is engaged, because nothing is worse for a client than sitting and watching somebody do something that you're not interested in at all. It may be necessary during an assessment to change your plan to accommodate the needs, the wishes, the wants of the client. If the client walks in and says, I'm not interested in learning how to play the piano, I don't like the piano sounds, then you as a therapist have the responsibility to adapt your plan to see what kind of information you can find. It's also important as a therapist to be able to justify why you made those choices and those changes. If you walk in and you have one assessment plan all put together and how you're going to proceed, and you have to change it for some reason, if somebody asks you, well, why did you change that? You have to be able to explain it. So here are some quick tips for effective assessments. First of all, make sure that you're preparing ahead of time. Have your list of questions, know what you want to do, and know what you need to know about the client at the end of the assessment time. Secondly, explain what you're doing to the client. Don't direct your comments towards the caregiver, but to the client. You can always include the caregiver in the discussion, but don't direct all of your comments to that other person. Third, offer choices. Fourth, take data in a manner that's as stealthy as possible to keep the focus on the music therapy process. It's very distracting if you say, stop, I have to go take data now. Fourth, adapt your plan to accommodate client requests and needs. Fifth, document all information promptly so you remember what happened in the session. Write it down first and then arrange it second. And sixth, when you're presenting your assessment findings, present this in a professional manner. Use appropriate grammar, use appropriate professional writing style, good punctuation, and check your spelling. Thanks for watching this music therapy morsel about assessments. If you're interested in learning more about how to accomplish a music therapy assessment, please check out the website at musictherapyworks.com on the webinars and courses page for more information. Thanks again for listening, and keep an eye out on this channel and on Facebook, Pinterest, and on the website for more music therapy morsels coming in the future.